I am really super excited. I am stoked, as some might say, that that we're doing this. I'm really very excited to introduce you to three folks that, unfortunately, they know me and they got roped into this. Apparently, I have some dirt on them. That's why they said yes. But wanted to introduce the three chefs. So, Dewey, say hi since you're on my screen first. Here's Chef
Hello,
Dewey.
everyone.
Totally related to Larry McMurtry, right?
Yeah.
Yeah, totally related. we have Chef Alex.
Hey, everybody.
Sadowski. There he is.
Good job. Way to pronounce it right, Tug.
Nailed it. That's what I do. And Chef Gary, not going to even try.
Hello, everybody.
Worstenbosch?
Forstenbos.
Worstenbosch.
Mm-hmm.
She's Dutch. You have the clogs, yeah? Sorry. I promise not to do that more than 5 more times.
Sure.
I promise not to do that any more than that. So let's go ahead and kind of get into a little bit of bios if we're good with that. Gary, since you're first on my screen, go ahead and tell us a little bit about yourself.
Sure. Went to culinary school when I was 12. I was born in the Netherlands, so when you're in a young age, you can already make decisions what you wanted to do. It mainly had to do because my dad worked for a big beer company, and he was, going to all these hotels, restaurants, and when I was a kid, I wanted to do the same thing, go with him and look in the kitchens, and that's why I went culinary directions. Then when I was 20-something, I traveled to the United States with some friends, just the culinary part of it.
Right.
And then met my wife, so we went back and forth. Eventually, I stayed here, and
the boss won.
Right. So I wanted to do learn a little bit more about the Southwestern cuisine. So I worked for Stephen Piles. I was thinking about taking that experience, go back home, but I'm still here. So, then I wanted to do something different. I wanted to go to healthcare to see what was going on in healthcare. I wanted to bring a different experience for patients here. When I was here the first week, I said, oh my God, did I make the right decision? Because it's a whole different world than coming out of the, regular kitchen.
Right.
When they gave me the opportunity to start here with room service and, could bring in my own staff, and retrained staff that was here. So we started room service in 2003. We do make everything itself in-house. So there is no, nothing made. Everything is from scratch. We even clean our own meats and fishes, right? Things like that. So,
Gary, where is here, by the way? You said here.
Sorry, I'm in Plano, Texas. I work for Texas Health Plano. It's a 16-group hospital.
How many beds?
We have 370. We're not the biggest. We're medium size in our in our company.
Sounds large to me.
It is, but it's not. We have some with close to.
It's always relative, right? There's always a bigger fish.
So, that's basically it. I'm still here, so enjoy it. We made so many changes here over the years.
Right.
Won even an Ivy Award years ago. So, that's about it.
Cool. Let's go with you, Dewey. Chef Dewey, tell us a little bit about yourself.
Grew up in distribution. My grandfather owns a small food distribution. Been cooking since '96. Went to the CIA in New York. Mentored under Master Chef Ernst Grusch. And I've been here at Texas Tech for 16 years now. Just got accepted to AAC.
Hey, all right. Congrats.
Thanks.
Let's go to Alexson. Same question, please.
All right. Well, I'm originally from the great frozen tundra of Minnesota.
Minnesota.
Got scared of the cold one day and moved down here to Texas. I've been cooking since I was 13. Started as a dishwasher, and the cooks all realized that I could help them out and make their jobs easier. So I've been hooked ever since. Just like Dewey, I also went to the CIA out at Hyde Park. I happened to go for one of the 4-year bachelor's degrees. Kind of cooked my way around everything. Country clubs, private clubs, I worked for Anheuser-Busch down at a gated community in Virginia for about a year as well. Ended up going back to Minnesota, opened my own restaurants, failed miserably, but made it out without any debt. So that was nice. And then started working for larger chains, kind of the higher end stuff. I worked for Front Burner Restaurants here in Dallas for quite a long time. I opened up all of their concepts, multi-state kind of regional chef. And then about 2 years ago, I moved to Twin Peaks. At the time, we were still owned by Front Burner. Then we were bought by a private equity company. So now we are just a standalone company. I'm the corporate chef for them. 100 restaurants, 26 states, mostly scratch kitchen, about 95% scratch. I mean, it's just massive, massive spread.
Absolutely. Absolutely. So I've got a, especially since we're here with you, Alex, let's go ahead and start with you. It sounds hokey, but how about an interesting fact about yourself?
I don't know, man. I'm Canadian. Does that count?
Counts. Done. Done. Gary?
I'm Dutch. Done.
American.
American. How about an interesting fact from you besides being American?
I have 2 kids that are 20 years apart.
Awesome. And you're into woodworking, and
Yeah.
that's a hobby. So I think we've gotten through the bios. No one's left yet. So thank you guys. Really appreciate it. Kind of how I'm thinking, I could be completely wrong, but want to kind of start throwing out ideas and direct it at somebody first, but then maybe ask others. And we have the chat, obviously, so I will keep track of it. If it's something especially super on topic, I will ask that. If not, we have a question and answer afterwards, but feel free to ask whenever, and I'll moderate when we ask it, I guess. So let's just get into it. COVID. Let's start with Dewey, since he's first on screen. I know the kids, for the most part, aren't back yet, but what's some of the, what are you guys doing right now as a good way to start? You're, as far as serving.
There is only Grubhub ordering currently. So they can order and pick up. We take it outside. We're doing away with all self-serve, even condiments. Just trying to limit cross-contamination as much as possible.
Right.
And then going even further, closing one of our dining halls that was self-serve.
Which one was that?
The Commons upstairs.
Oh.
BG will stay open because we can convert that to service easier.
Sure.
You can't get rid of all your dining halls, but
Right.
yeah, I think our main focus right now is cross-contamination and social distance. So.
Makes a lot of sense. What would you say the biggest challenges are right now? Just kind of throwing a dart against the board, or?
Yeah, just being in limbo on opening, not opening. What are we going to, we're getting ready, but we don't know what we're getting ready for, I guess,
Right. One of the reasons I have you guys, you three, is you guys are really so different segment-wise, right? I mean, with being a college university, for the most part, you have most of your staff and student customers coming in at a certain time, whereas with like Gary, hospital, you guys have been open the entire time, and then Alex, obviously, with a chain that is just, who didn't really do any to go before, right, Alex?
Yeah. So it was less than 0.5% of our sales. Now we've been doing it for 3 weeks, really, full bore. It's about 11% of our sales, average between all the restaurants.
Impressive. Go from pretty much zero.
Yeah, and it's also a process that would have taken us about 6 or 8 months to roll out. We did it in 4 days. So we're living through all the problems that created, but I mean,
Sure.
it kind of tells you not just, I mean, it's going to be the entire industry across the board, right? What we used to think would take forever to move a mountain,
Mm-hmm.
when you cut all that kind of second guessing out, how fast could you actually affect a change if you need to?
Sure. So Gary, how about you? How about some of the hurdles you've had?
We basically also had to get rid of all the self-serve, so we do more to go now. We have serving areas that always stayed open. For the patients, I mean, we had COVID units that we had to have a whole different serving style for, because we had to conserve PPE, also limited contact with patients. So we basically, instead of our room service there, we have a set menu that goes up at certain times. We had doctors' lounges that had to close down because there was self-service, so we invite them all to come into our dining room now. The challenges were the distancing, and there's no seating in the dining room, so that's basically a big challenge for people to go. Now, the last couple of weeks, we opened up a few areas where they can sit, but only 1 to 2 people at a table. It depends on how big the table is.
Wow. Are you guys opening up that patio area?
The patio is open also, but also for 1 to 2 people at a table. So
Sure.
we have stickers where they can sit and go and things like that.
Gotcha.
And then we constantly, when somebody leaves, we have to clean up. So
Makes sense. Hey, Alex, where are you getting most of your direction from as far as the facilities and regulations? Is it from the local health inspector, especially since you guys are nationwide? Where are you guys getting it from?
Well, really, it started more nationally. A lot of it from Data Essentials, EcoLab, some of the really large groups, right? And
Yeah.
just Zoom and webinar meetings just like this. And we ended up running into that we actually had to educate a lot of the local health inspectors. I mean, a lot of people are used to that, right? But we kind of sought out, because we were one of the first chains to fully open. We're at 100% open in every single state. And the regulations are so different, like you talked about, but we've had to set the bar very high personally. So when an inspector comes in, we're kind of training them what to look for, right?
Sure.
Here's our whole process. This is what you're going to go through. We're following all the procedures more than whatever they're asking. So
you guys go to the highest level, and then that's just kind of standard for everybody, whether it's state regulated or not.
yeah, because we can't afford to shut a restaurant down again. Really. I mean, it will happen, right? But if we are in all of these different states and it's shut 1 down here, shut 3 down there, I mean, the whole system will crumble really quickly.
Sure. How about you, Gary? Where do you get it from? About the same?
yeah, and it's also, because we're a big hospital group, we do meetings, every other day to see what's working, what's not working, just to help each other out. So, because there were some changes that are made. So, and it's always good to have, anybody's, eyes and ears and see what works there and all that.
Sure. So Dewey, kind of along that same line, now that there's changes, who's making the decisions on what to change and how to change? Is that all on your shoulders, or is it something where it's a group, or is it above you and it's just the president saying, do this?
Well, yeah,
We're
first
recording this.
first it starts with the state,
Sure.
then it goes to the president, then it goes to our FO, which trickles down to us, and then our department has a safety coordinator.
Okay.
So who's kind of headlining or heading up all the training, sanitation stations, borders, I guess you could say, or ropes to keep people separated, tape or rugs, whatever we're going to use. But we start with the state, and then it gets refined before it gets to us, I guess.
So then who makes the ultimate decision? Is it like the director, like David, or is it you, or is it a team?
Currently it's just been the director.
Okay.
But we do meet about it and discuss it together, I guess. So
Perfect. How about right back to you, Gary? Kind of the same idea, or is it?
Yeah, normally, I make those decisions, and and then we'll go from there. I mean, we have already so many strict guidelines anyway, working in a hospital with CMS
Right.
coming in, Joint Commission coming in, things like that. So, um, yeah.
Makes sense. Alex, I do want to ask you this one too. Who is it? A team thing? Is it they kind of put it to two people? Who decides what?
No, it was a full team thing. We got down to only about 24 employees, non-furloughed. Half that is kind of the people in the field, right? Director of operations, things like that. So really it was about a group of 12 of us. Just conference calls every single day. Built this massive Excel document with every piece of information from everyone, and we all kind of just talked through it and round tabled it.
Sure.
And we are also taking input from a lot of our franchisees too. So just whatever we could get as far as information, and then we all just decided, all right, well, we think this is the best course of action. Everybody good. We went with
Right.
it.
It's nice to have a team to talk through it. So one of the things we were talking about in our pre-meeting is limited staff and limited food supplies available, just kind of like the grocery stores were. I don't see it as much right now, but certainly were. You're having a tough time sourcing some of the products that you guys standardly use. So how do you guys plan on, especially, let's start with Gary, how do you plan on a menu for X number of beds and staff, cafeteria and cafe and things like that? How do you guys plan for that?
See, like we always have to have a 3-day supply of either, like water, food, and everything here.
Sure.
So, we always have menus in places that if there would be a disaster, that is also food in those 3 days is also for the community around us. So we always have plenty of them here. Now, when it comes to the little bitties here that we have, okay, we didn't get this product in or that product in, then we just made some easy changes on our menu and let the patients know that too. For the dining room, what we did there is we didn't advertise what we were going to do because we didn't know what we could get in. So
Right.
the day off, that's when we advertised what we had.
Gotcha. Alex, especially nationwide, I mean, you guys have printed menus. Are you guys using like chalkboards?
Well, we got rid of the printed menus.
Right.
So we moved more towards the QR code that you see a lot of people doing. That's where we really think the future is going to lie. So it's made us more flexible. We do have the ability to hand out just a paper single-use printout menu, but it's
Right.
cheap, right? It's just a black and white PDF that they can print at the restaurant. So
Right.
I can change today what we're serving tomorrow at any location.
It's pretty neat, especially considering you guys didn't really used to do daily specials or LTO things.
Not at all. The name of the game, the direction that we got from Joe, the CEO, is no more sacred cows at all. Be flexible and question everything. And if we're going to screw up, now's the time to screw up because we can blame it on Corona.
Not bad. How about the same for you, Dewey? Especially with, right now you're talking about admissions is higher, right?
Yes.
How many
So,
students?
it's over 39,000 now. So, we've consolidated what we use. So, for instance, we've cut back from 3 chicken breasts to 1 chicken breast, so that we don't have as many options. And then we're working with the manufacturers now on projections, things like that, trying to avoid the same issues that Gary and them are dealing with right now.
Right, because really the kids aren't back yet.
Yeah.
But the kids are also a lot of your staff too, right?
50% probably. So we'll see how that goes too. I mean, we're kind of flying by the seat of our pants right now.
It was a hell of a scared face. We should go back and screenshot that one later.
It's already tough, So.
Yeah. So we have a question in the chat. We have a couple of them, but are you guys using any of the online resources like ServSafe videos being free now, etc., to implement and update best practices? Alex, I see you nodding your head. Go for it.
Oh yeah, pretty much all of those resources we've leveraged. So before because we weren't doing third party before or really any delivery,
Right.
we're also in a weird position because we fully shut down every restaurant in the country. So we took those kind of 4 to 6 weeks, depending on locations, to super deep clean the restaurants, clean, sanitize everything, all of the R&M stuff that was always kind of falling to the wayside because you were open and just busy.
Right.
Painting, staining, landscaping, you name it, we did it. While the staff were furloughed, we went to all of those sorts of resources and made everybody recertify. So even in other states, Texas, right, requires a ServSafe food handler certification and also a TABC certification. Well, we did that across the country for every single one of our employees, front and back of the house. So I think all of these larger companies like ServSafe that moved to being free during this time, it's been invaluable. It's such a help. And I think it's really going to make an impact moving forward of how safe are all of us going to be.
I'd agree with that. I'd absolutely agree with that. Gary, do you have anything to add on that?
Yeah, I mean, it is good for our staff when it became free, you know, because some of our staff, their licenses were expiring. So,
Sure.
you know, they went on there. And even during our department meetings, we always show a best practices, you know, to staff. I mean, because it's always a good thing to do.
Right. Absolutely. So let's go with, especially for you, Gary, what are you guys doing in place of self-serve? And Dewey, you're going to be questioning this here in a second too. So Gary, what are you guys doing instead of the self-serve?
You know, we have a lot more grab and go now, so we put a lot of resources in there. But then again, packaging became a problem, so we had to be creative with that because, you know, a lot of stuff was not coming in. So
Right.
we still had
labeling is kind of
labeling, yeah. And then we still had a serving area. Plus, we still had a deli where we also make pizzas and things like that.
Mhm.
Grill, so that's still all going. We you know, have more grab and go. That's basically the way we went now, grab and go. And we were looking into doing deliveries throughout the hospital itself, so nobody had to come down. But it became a resource issue with staffing and things like that. So we had to stop thinking about that for now. So
Makes sense. Dewey, are you guys, almost all your serving areas, do they have breath guards? I think
sneeze guards, yeah.
Is it like on one of them I can think of at Bledsoe has an open area for the most part on one of the lines there. Is that something you guys are going to be putting a breath guard up kind of thing, or a plexiglass?
Yes. So we're going to eliminate any risk involved without having a sneeze guard. Sneeze guards will go in place. We're also going to more of a kiosk format.
Mm-hmm.
So we're keeping them away from our lines. Say at the market, our biggest location's already implemented that, and we're going to look at doing it a few other places. Online ordering, we're developing in an app. So if they want to order it, they just come in and grab it and go. Social distancing are probably our biggest challenge on campus when you're cramming, you know, tens of thousands of people on a small footprint. And then vending machines, refrigerated vending machines that can do grab and go and things like that. We can spread out a little bit easier.
Sure. That makes a lot of sense. So the spacing, and this is mainly going to be to Alex, but it definitely could be to you, Dewey, and Gary. Spacing for booths and tables and whatnot. What are you doing? And then also we've seen, at least in North Texas, I don't know elsewhere, that if you put up plexiglass between booths, you can have back-to-back booths populated. What are you guys doing?
So yes, you can do that. We can't do that everywhere. Depends on the state and the individual city. So we, as a brand, are not doing the plexiglass thing. We tried it in a few of the franchisee locations for bar separation. It didn't work. As soon as people start drinking, out the window, man. Having
around it.
Glass didn't stop anybody.
Yeah.
So really what we've seen, the best thing that we've seen for as far as spacing goes, a lot of the restaurants have been pushing tables directly up against our bar tops, like little 2-top high tables.
Okay.
So that is your designated seat. It kind of took up enough room and gave a 6-foot distance to the bartenders, but still had you have that feel of being at a bar top.
Sure.
The customers seem to respect that sort of a setup more than the plexiglass stuff that we sell.
That makes sense. Sounds like a great idea, actually. How about you, Dewey? Are you guys going to be, because from what I remember, right, there's booths and there's tables, and what are
Yeah.
your guys' plans on that? You guys taking tables out?
Currently we are, but we'll play the rules and be as flexible as we can, and so I can see us investing in a lot of plastic,
A lot.
just to add a little bit more separation. So,
Sure. So things that, like, to not lose a booth, you guys would put up the plexiglass between.
correct.
Gotcha. That makes a lot of sense. Gary, I'm assuming that's probably pretty close.
Yeah, we had only we had in the beginning no tables, no seating, no nothing.
Mm-hmm.
Eventually, when they let us, we put only a few tables out. We have stickers everywhere where to go in and where to keep your 6-foot distance everywhere. So then again, I mean, we have to be masked. So our risk to put plexiglass, anything down there, it's probably not going to do much because we have to wear a mask getting in the building regardless. So we don't have to go that direction yet.
That's everybody, right? To get into the building, you have to have a mask.
Anybody needs to have a mask, so you
It's-
cannot get in without.
And it's not a cloth mask either, right? It's like an N95.
It's a surgical mask. So
Yeah, okay.
I mean, anybody that gets in the building gets temped, gets they ask questions, and then they hand them a mask. They have to hand sanitizer.
Makes sense. Makes sense. So I think we might have touched on a little bit, but just about everybody on this call, I'm certain, knows that there's problems in the industry with labor already, right? Trying to find solid people, good people that can even just show up on time is an issue. Beyond just that, what other added challenges are we seeing through this pandemic? I'll stick with you, Gary.
Well, it was just getting certain products in. I mean, when we did the grab and go, we had we were running out of all kinds of plasticware, and
Sure.
it's labor. I had some cooks coming in, and then they said, "Well, I'm going to make more unemployment than working for you." So it's like, okay, really? So basically the challenge is getting everything in that you needed to get in.
Right.
But as professionals, I mean, we have to adapt to anything anyway in our industry because it's just the way food service works. It's with
Is there
staffing.
anything? Sorry, keep going. What?
Go ahead.
I was going to say, is there anything anybody on this call could do to help get any of that stuff in, or help support?
Yeah, start manufacturing in the United States. Gloves, to-go boxes, cardboard boxes, you name it. Because the supply chain is what hurt everybody, at least from what I'm hearing.
Sure.
Yeah, and Alex is correct in that. I mean, because when it all started in China, that's when all of a sudden we had shortages in all those kind of things, in plasticware and boxes.
Right. Yep. Makes good sense to me. What in the chef's point of view, and we'll start with Dewey, what's the most pressing issue right now for you guys?
For us on campus,
Or in the industry, in your opinion? It doesn't even have to just be tech.
labor.
Yeah.
Still labor. And then this is just an added pile on top of all of that, There's already a struggle. And then a lot of people who are making more on unemployment than they are working, getting them back is a real challenge.
Right.
Yeah.
I think, Alex, you were saying the same thing, right? That a lot of your folks are making more on unemployment.
Yes and no. I mean, it was 50-50 for us. And we had the ability to start grabbing and employing people that wanted to work from kind of the small independent restaurants, right? Because we still are a scratch kitchen. It is a bonus to a lot of cooks that they come and see us with the char grill and with a, real cooking appliances and cooking actual food, fresh produce that comes in. made us more attractive to the people that want to work. They don't want to
Sure.
take unemployment. They'll do anything they can to stay off of unemployment.
That's cool. That's cool. Gary, same to you.
Yeah.
What do you think?
You know, also the onboarding process for us, it's kind of an issue too. It takes forever to get somebody on board here because all
Yeah.
the screening you have to go through before working in a hospital. So basically, they would come in here and they say yes to me, but then Alex said, "Hey, you can start with me tomorrow." Well, then I'll lose them automatically because of that, you know, because they don't want to wait 3 weeks or a month before
Sorry.
they get board. So, so, but that's just a pain to get people in here. It's just
Sure.
an onboarding process.
It makes a lot of sense.
I mean, I wish I could hire him on the spot, but it doesn't work.
Not how you guys work. Yeah. Yeah. What would you say is the best, the most innovative change you guys have made that you felt has like, oh wow, that made things a lot easier? Let's start with Alex, especially since you guys are in it.
Well, I think it's a double-edged sword, right? But we were forced to relax all of our specs for the food that we were purchasing.
Right.
It made it a lot easier for us to actually physically get food in. But I think, you know, in the future, I'm already dealing with it. Getting back to what we were doing before is such a struggle. So, dual answer for you. Sorry.
That's fine. That's fine. Dewey, you guys aren't really quite up and going yet, but what do you guys think as far as the plans you've made will be the easiest thing for everyone? Well, the thing that makes things easiest.
I don't know how to answer that.
I know you don't really have all the kids there yet. What, you don't have a crystal ball? It's ridiculous.
Yeah.
It's ridiculous.
We're planning as much as, you know, we're planning as normally as possible with a lot more trainings planned and things like that. But yeah, it's still up in the air, and now cases are spiking. So kind of we're still filling it out, waiting to see.
Sure. How about you, Gary? You guys feel that you have something that was really pretty interesting, or if you've seen somebody else do something really eye-catching?
No, I mean, just like I think our grab and go, it's been very good. So as a system, we're talking now about investing into an app that people can order from out the hospital buildings,
Right.
towers, and all that. So we're working on that as a system because I think that will be beneficial too, so people don't have to go out. The only thing is, like I said, we need to have some resources how to deliver. That's just going to be a struggle.
Sure.
But we can always make a pickup area. But
Right. Just need a couple of plugs.
there you go.
Something warm.
Some of your equipment, right?
Well, thank you for that. That was going to be the next question. John asked in the chat early, but what assistance are you chefs seeking from kitchen equipment suppliers or reps that can help you guys with changes in COVID and whatnot? We'll start with you, Gary.
Well, you can come and help me if I'm short on staff, right? Be one of my cooks.
I know how to use some of your ovens pretty dang well.
There you
He's
go.
available every day.
Wait, I thought the hiring process is
Hi, you're my vendor, right?
right?
You're not on my payroll.
Lord forbid if they run a background check on your kid.
Thank God they don't do that. Thanks, Jeff. Thanks for not doing a background check. Dewey, let's go to you. Is there what can, and it doesn't have to be Miller specific, dealers, other rep groups, what is it that you guys think that we could?
Sealers for sure. I was saying that the other day. Vacuum sealers because of meal kits and more ready to eat meals was part of grab and go. Vending, like maybe your salad machine, things like that.
Robot.
And refrigeration, blast chillers, doing more ready to eat foods and things like that.
Sure. Makes a lot of sense.
Those are the big ones.
Yeah. Alex?
So I'll just go a little bit more broad. I think this has just accelerated everything that we saw coming, what was going to be the future. and just really shorten the timeline of when it's going to happen.
Makes
So
sense.
kind of along the same lines as Dewey, right? It is going to be glass chillers and programmable ovens and, innovative heating solutions, hot hold solutions, stuff that you can do to reduce labor, increase your consistency with less trained people, right? Increase your viable shelf life of those products. I mean, I think we are all on the right track. I think it's just cut probably 3 to 5 years off of when people thought they were going to need it.
Right, because it wasn't a priority before, and now it is.
Yep.
So last question, and then we'll get to question and answer. How do you, and this is a crystal ball question, right? So this is me spitballing. I'm dealing with this myself, but how do you guys think that we're going to be able to not get fatigued by staying vigilant in our hand washing, our mask wearing, our wiping and washing the door handles, the tables? How is it that we're going to be able to stay vigilant with our staffs? Let's start with Dewey.
Shock collars. No, we're just gonna do the best we can and try not to get
Complacency.
anybody sick, and then hopefully it will turn into more of a habit. We'll be so clean that we can't even get the cold without suffering. But we'll see.
How about you, Gary? How do we keep the staffs?
We having huddles and remind ourselves what to do, what not to do, and because it's very easy to get complacent in this time, you know what I mean, and forget things. But it's every day. I mean, from the servers to our dining room to our cooks. I mean, everybody has their little staff huddles for a few minutes and remind everybody what their task is.
Sure. Alex, anything to add to that?
Well, I mean, I think, and mostly just dealing with Texas right now, right?
Sure.
Everybody is so fearful and scared that they're kind of scared straight. is the good thing, right? Yes,
well,
we have to stay.
But I was just in Central Texas. Was it Wednesday? Yesterday, and I went into a very, very large convenience store that might have a lot of gas pumps and do a lot of food service there. You guys can figure it out. I did a mental count and kept track, and I got to 40 people without masks and 10 people with masks.
I'm not talking about general public. I'm talking about our staff, right?
Good.
Our staff is still so scared about becoming sick themselves that I'm seeing them, and we put everybody through Serve Safe, so that helps, right? They're overly washing their hands, changing their gloves more often than they absolutely need to, using sanitizer more, right? I don't know how long that's going to last, but at least right now, staff-wise, they're all scared in a good way.
That's especially like hearing the changing of gloves, man. That's one of my, not you specifically, right, your guys' things, but man, I go to many places and like, you just picked up a phone with your glove on and now you're just going right back to it for
don't tell my controller that we're going through $1,000 a week worth of gloves.
I think at this point, that's better than
the opposite. Absolutely.
The opposite, getting somebody sick. So here we go. Some of the questions, question and answer. Let me ask this before we get to the Q&A. Is there something one of you three would like to ask the other that you think, hey, what are you guys doing with this? Or is there anything along those lines? No is an okay answer, but I was just asking.
No, I'm good.
I can't think of anything.
Perfect. So let's go with, what are we doing with the old serving line, like the salad bars and things that we had? Are you guys using them now to hold to-go items, or, and this is mainly obviously for Gary and Dewey, because you guys didn't have any serving room balance.
Yes, we basically use it all for our grab and go now.
Okay. I'm guessing that's the same for you, Dewey? In plan, at least.
We converted a lot of our salad bars to salad by the pound, where we build it for them. And we only have one salad bar that was self-serve, and it will now be served also.
Gotcha. What do we think the average increase of costs for items? Average increase of cost? What? Hang on. Reading's hard sometimes. How are you utilizing the existing salad bars? I already said that. Average increase of cost of added items for protection. I don't know what you mean, Dan. Sorry.
I
Gloves,
can speak to that. It's what I was just talking about. So gloves, masks, sanitizer, bulk sanitizer for spraying down, right? Peroxide based, etc. You name it. We're looking at about $1,000 per week per location, just in COVID protection items.
Wow. And that's for back of house or front of house or both?
Total, just because it's blended, right? Because before gloves only used to be for back of the house. Well, now servers are wearing them when they're running food, bussers are wearing them to clear tables, bartenders are wearing them while they're producing drinks. You couldn't really say, here's the split anymore. It's all blended.
Gotcha. Dewey, are you guys planning on doing any like specific times for the students as far as to limit folks in the, say like Sam's?
I haven't heard anything, but I'm hoping that that's something they'll look at doing. Maybe spreading out the class schedule a little bit better to not overrun areas like we currently do.
Sure.
Yeah, that's a good idea.
But I can't say I don't know anything on that. It's way above my pay scale. So
So we've seen before where people are putting added charges to when we've had shortages of things, right? From a restaurant or whatever. Are you guys thinking about adding a supply charge or like a
Surcharge?
charge? Yeah, surcharge as it were.
you know,
We're going to increase menu prices. I know
Yeah.
Dewey and Gary are kind of less flexible on that sort of stuff, but now with the QR codes, if I see gloves went up, Joe will just say, all right, tack on 25 cents to everything on the menu.
Makes a lot of sense. Where are the QR codes that they're scanning, Alex?
So there is kind of front large posters when you
Yeah.
enter the building, and then there's medallions on every single table. Some of the larger tables, there's a medallion per every 2 seats. And you can get to it through the website as well. He'll tag to the individual geotagged table. The whole technology is really, really cool, actually.
That is cool, especially considering you guys came up with it in a couple months back.
Oh, there's a whole lot of problems with it too, but overall, it's really cool.
I mean, I think that's what this is, though, right? There's a lot of trial and error, especially since you guys didn't do a pick up to go program. It's now 4 days and 3 months into it, as it were.
Yep.
So, are there any questions? I think we have gone through those on the side. Anybody have any other questions you can think of that you want to ask?
Hey, Tug, I had one
Go for
from earlier, and I can't remember if it was Gary or Dewey, but I was curious if they could elaborate more on the clusters versus the serving counters that they were talking about, just that style of serving and kind of what that looks like to the person who's eating in the location.
All right, let's go with you, Dewey.
okay, so we're talking about crowds. I'm sorry, I
Yeah,
misunderstood the question, I guess.
I think earlier it might have been you, Dewey, but it could have been Gary. I couldn't remember. But one of you mentioned going away from serving lines and more to clusters. And I just would love to hear more about what that looked like.
No, that's just this is for the COVID units. Basically, what we do is we try to eliminate as much interaction with these patients. So with nursing, collaboration with nursing, we serve those floors then at a certain time. The nurses will bring in the food, but they also then take their blood pressure, they do all their medication and all this kind of stuff. So we can preserve PPE and we don't have to have everybody going in the room and get exposure to it. So that's what we decided that we're doing here when all this started.
Gotcha. Is that good, Jeffrey?
And then I think Dewey mentioned the kiosks and kind of what those look like too.
Yeah, so Our first run started last fall at our highest volume location. As big as it is, it just gets so crowded and slowed down by the crowds also.
Mm-hmm.
That we've moved kiosk screens to the front where the dining area is, so they order their food now up front instead of at the line, and we call it out when it's ready. So that gives us more people to prepare the food in the back instead of taking orders in the back. And then we can get through the lines faster because they're not waiting as long conversating with servers and cooks and things.
Sure.
And then we have smaller footprint kiosks that are more grab and go, grab a water, pay and go, grab a salad, pay and go, coffee, something like that.
Gotcha.
And then we're only going to expand that. It's worked pretty well, though we had some pushback from the upperclassmen who liked the way it was,
Sure.
But we're finding that, nobody, if you can save anybody any amount of time, the convenience is important to people, and then it just happens to work out with the COVID and things that's a better style of service for the pandemic,
Sure. Makes good sense. So I have one last question that I want to kind of leave us with. I posted this on Facebook, right, of, hey, we're going to be doing this. And one of my friends, he lives in Seattle, but he said, is it even going to be possible for us to have restaurants post-COVID? What are you guys' thoughts on that?
I think it's going to be a challenge. It's going to be harder than it already was with all the competition and everything. Meal kits are very popular. I think that's an avenue that some restaurants could take because they've all got signature things that make them special and popular.
Sure.
And if they could make that work for someone to do themselves, that's an avenue. But too, I think you have that social fear of interacting with other people, and that's not going to help either. Though I'm not the expert on restaurants. That's just my opinion.
Right.
Alex.
That's what we want is your guys' opinions. How about you, Gary? Let's go with Gary next.
I think it hurts the mom and pop restaurants, all this, and will be future too. Well, the restaurants near my house, when they said they can have 75% open, I mean, the places were packed. So I believe if everything is gone, people will go.
Yeah.
Is there fear, like Dewey said? Yes, there is, and there will always be. But I believe that people are going on with their lives when everything is said and done.
Sure. Dewey, did you just have to hit the motion sensor to keep the lights on?
Yeah.
Alex, let's finish with you. You have 100 restaurants.
Yeah, we have 100 restaurants that are sports bars, right? I don't even have any sports going on right now. Depending on the social distancing, right? Our average is 80% of sales of last year. I have several stores that are up over last year, depending on the day. So I don't think the general public either thinks it's real or cares. Kind of like what Gary said, right? They were packed. The restaurants are packed. If I wasn't going to follow the rules, I could be at 100% capacity and 2 hours wait every day. So I think restaurants aren't going anywhere. I do agree. I think the independents, you'll see some of them go away. Same thing that it's doing for everything else. It's just accelerating. Those restaurants probably weren't doing the best to begin with, or it's out of their control and it was just a bad rent situation or something along those lines. Sure. They were going to fail one way or another. I think you're going to see everything kind of shrink a little bit down, general restaurants, and then you'll see a boom just from real estate opening up, people saying, you know what, I'm just going to jump in and I think I can do restaurants pretty well. Yeah. Not that they can, right? But I think in about a year or two, hopefully by that time we have the vaccine and everything's kind of cleared up, you'll see a restaurant boom again.
Fingers crossed.
Yes.
Fingers crossed. Thank you guys very much. I really appreciate all the time. Thank you to everybody who attended today. We really absolutely appreciate that. I'm going to tell you, as far as Tug Time, we were talking last week actually, and we were going to make it to where instead of doing twice a week, next week we're going to start once a week. But we haven't quite decided if it's going to be Tuesday or Thursday. I think our vote is Thursday, but if you guys want to put it in the chat, which one you'd prefer for that week, because we have July 4th right after that. So we're going to go down to once a week next week, and we might even do a little changing on some of the content too. We'll see. Thank you guys very much. Really appreciate it. I owe you lots and lots of beer and or sausage or I don't know. I said sausage. I was looking at Alex's beard and it just said, man, that guy needs some mustard and brats now.
That's exactly what I need.
Mustard and brats.
Thank you.
Tug.
Yes.
Beer and sausage.
I am what I am.
It'd be a great restaurant name, Beer and Sausage.
Beer, don't forget the mustard, dude.
Yeah, I think that's a given.
Yeah. So it's mustard, brats, and beer. It's like every Milwaukee restaurant. Thank you guys. Really appreciate it.